Hello, I'm Renzo Huber from NIH, and this ISMRM poster is entitled Should I do 70 fMRI with the pTx coil or the sTx coil? Consider the difference in geometry. And this is a community project with 28 contributors, and we are looking at our beloved 32-channel Nova coils with more than 30 arrays, including Siemens and Philips. And these coils emerged from an engineering challenge for prototype scanners just a few years ago, now to a standardized clinical product. Unfortunately, however, the research community knows very little about these standards, their consistency, and it's unclear if the pTx coil is also superior in applications where we are less challenged by P1 plus in homogeneity. fMRI folks, for example, care more about the receive side. Is that the same? But there's no knowledge in the academic literature about this. If you hold those coils next to each other, you can see that the cover for the pTx coil seems to be bigger. But does that mean that also the active elements within the cover are bigger? For example, that we have more coverage specifically down towards the brain if we want to do fMRI in the lower part of the brain? Nobody knows, aside of those people having access to proprietary industry design knowledge. The receive side looks very, very similar across those coils from the outside, but is it performing the same? Nobody knows. I have no financial interest to disclose with respect to this presentation. In this study, we compared the performance of many coils on the same scanner and also the same coils on many scanners. We covered them in MR visible beeswax to map out the size of the elements directly in MRI images, and we also took CT scans of 6 of those coils. 26 coils were investigated with the coil util standard QA sequence, and this coil util sequence is a Siemens service protocol originally developed by Jonathan Polimeni and then also ported to the newer scanner platforms, providing a single slice flash image as well as coil correlation maps for the received channels. So let's start by comparing those results first. Across 13 sites, we find that the off-isocenter difference is very consistent, namely that the pTx in blue is always deeper and closer to the patient table than the sTx coil in red. So be aware that they might also have different head tilting and different size of seeing the mirrors. This is also independent of the fact that the Terra sites are always deeper than the 70 plus scanners, which is simply due to the different patient table, as you might know already. The casing is also just a tiny bit different, with smaller differences in the visual field of view as well for the participants. The center of the head is shifted with the center of the transmit coil isocenter then also as well with respect to the gradient isocenter. Across the sample of coils that we looked at, these sTx coils seem to vary quite a bit across different scanners. There seem to be different submodels within the same specification, whereas the pTx coil is much more stable across sites. So if you want to start a cross-site study across different scanners that includes different scanner types or maybe even vendors, you might want to use the pTx coil instead, which seems to be more similar. Looking at the results from the CP scans, we can see that while the cover of the pTx coil is larger compared to the sTx coil, the active elements seem to be actually smaller, so we have less transmit coverage for pTx compared to sTx. This means that when you put a brain in there, the top of the motor cortex might actually be outside the transmit field. For the pTx, not so much for the sTx. At the bottom of the brain, however, you can see that we have these smaller elements deeper, allowing maybe to have more transmit efficiency at the lower part of the brain, which is also something that you see flipping back and forth the B1 plus maps in the same person here for the different coils. So you can see that the bottom of the temporal lobe are more illuminated with the pTx coil in CP mode compared to the sTx coil. At the same time, however, because of these different geometries and the positioning of the head casing, the plastic cover, we see that the central brightening is shifted towards the anterior direction. So with the pTx coil, we actually have less efficiency in the visual cortex because the central brightening is moved further towards the front. And these differences in geometry then also have some effect on the receive sensitivity, which can be seen by looking at the effective SNR. Namely that the receiver sensitivity, as you might know, is not completely flat across all frequencies. Off-resonant frequencies are often more sensitive within the allowed range. So we went to the scanner and just measured the SNR while pulling out the patient table more and more and more and more. And indeed, with the phantom in the identical position in the coil, just having a different gradient, we see that the peak SNR varies by about 40%, which can explain some of the differences that we have been seen by comparing the receive sensitivity of the sTx and the pTx coil. Namely, just having a sample a bit off isocenter in the pTx coil can then boost the sensitivity because we are more off resonant. Next, let's look at the noise correlation of the receivers across 32 channels here of 16 pairs of coils. There's some heterogeneity depending on the loading of the coil, but there are also very consistent differences which become apparent as soon as you average all the results for the sTx and the pTx coils. So you can see that the pTx and the sTx have quite different correlation matrices. You see that for the pTx, we actually have less overall correlation of the received channels as opposed to the sTx. However, for the pTx, we have these kind of isolated hot elements over here, which interestingly seem to correspond to the lower row of the channels, which might come from these different geometry that we saw earlier, namely that the transmit elements are actually now more overlapping with these lower row of the receivers for the pTx coil, but not the sTx coil. And when we look at the significant difference of the noise correlation matrices for all the pTx coils compared to all the sTx coils, it matches quite nicely with some few exceptions. There are other features that we see in these noise correlation matrices. For example, we see that we have more noise coupling in the individual spokes of this design as opposed to across the different spokes. These results are also quite consistent for the two different models. We also see these weird squares over here, which seem to be just an issue of the coil numbering for these frontal spokes over there. When you look more onto the element combinations that are less noise coupled for the pTx compared to the sTx, you can see that it's these top pairs of the spokes that are better decoupled for the pTx compared to the sTx, consistent across sites. And these different couplings then also have an effect on the G factors that are usually getting a lot of attention in fMRI protocols. For example, we do see very consistently that the pTx coil, while having the same design of the receivers, has a higher G factor because of this different overlap of the transmit elements compared to the sTx coil. The sTx coil always has a lower G factor compared to the pTx elements, specifically in the lower part of the brain. As shown at different abstracts at this very conference, however, these G factor penalties are usually not the most limiting thing in fMRI protocols. As you see that as you go to higher and higher and higher G factors and from higher and higher acceleration factors, usually in fMRI we are more limited by these artifacts than we are by the noise amplification. And these artifacts can usually be accounted for by other means, for example this Frisco method that is described over here. So G factor noise amplification at grappa 4 or 8 is usually not a limiting factor. It only becomes an issue as you go to grappa 20 or 24. In conclusion, when you decide on which coil to use for your fMRI protocol, do not only consider pTx shimming options, but also keep in mind that they are just different coils with different geometries. I'm not implying that there's any design flaw in any of those coils, right? They're just different coils. And depending on whether you're more limited by noise coupling in accelerated fMRI protocols, or depending on whether you care more about upper or lower brain areas, you might be better off with one coil or the other. Here I made a little decision tree. So if you want to use pTx shimming in your fMRI, there's no question you use the pTx coil. If you are not really limited by B1 plus in homogeneity, you might have other options, and you might want to see if you're more limited by SAR. For example, then you would want to use the sTx coil, allowing you to go to larger flip angles that are less homogeneous as opposed to using pTx shimming. If you're more limited by the excitation of the lower brain elements, you might be better off with the pTx coil. If you're not limited by excitation but more by noise in the lower elements, then you might be better off with the sTx coil. And with this, I thank our partners in the industry, and I thank you for your attention.